Good morning, everyone. Dr. Litvin here. After we've gone over some basics of diabetes and we've described the two main types, type 1 and type 2, let's now go a little deeper into each one of these types and try to define further what they're about. So, about 10% of all diabetics present with type 1 diabetes. As you remember, this is also called juvenile diabetes. And as we stated before, these patients are typically insulin dependent. Uh, at presentation, they're usually very hyperglycemic, and usually they present at a younger age, and that's why they're called juvenile diabetes. And what happens typically is that there's an immunological attack on their beta cells. We don't fully understand, but we think that for some reason the immune system is stimulated by some virus, and this gets the immune system to create antibodies that then attack the beta cells. This attack on the beta cells causes acute damage of these cells, and insulin production drops very dramatically into near zero. Without insulin production, of course, glucose levels escalate and become very, very elevated, and this causes a crescendo of symptoms to develop. When typically we see patients like this, they come in either through the emergency room or to our office with symptoms that are typical of severe hyperglycemia, and these are typically with a lot of urination, consequent thirst, weight loss, lack of energy, and feeling sick. These patients' blood glucose typically ranges in the hundreds, and this glucose level ends up in the urine. Kidneys are unable to handle these kind of levels, and with a lot of glucose in the urine, patients urinate large volumes of urine. Given the fact that the glucose is unavailable to the tissues because of the lack of insulin, very high glucose just goes, as I said, through the urine and basically disappears, which are calories. Patients lose weight consequently. And more importantly, because this glucose is unavailable for the tissues to use as an energy source, the body has to resort to different sources of energy to maintain its functions. And typically the body resorts to fat as a source of energy and metabolizes the fat tissue that's still available. As a byproduct of this metabolism, there is the production of something called ketone bodies, and basically patients go into something that we call ketoacidosis, because these are acidic. Ketoacidosis is also described as DKA, and type 1 diabetic patients who lack insulin quite often present with DKA, which is a life-threatening situation where, in addition to very severe hyperglycemia and whatever I just finished describing, patients also have acid in their blood, and this can cause death unless it's corrected promptly. These patients are admitted to the hospital. They have to get an IV of fluids. They have to have insulin intravenously, and sometimes they need correction of their acid and some of their electrolytes. So patients who present this way may have a short period afterwards where the beta cells kind of kick back in for a short while, but inevitably they develop the classical type 1 diabetes, which needs to be treated with insulin for the rest of their lives. We'll go over the various insulins that are available and how they're administered in the next talk. I hope this was informative. Have a great day, Dr. Litvin.